Hello and welcome to Justice. I'm Judge Jeanine Pirro. Thanks for being with us tonight. An historic event, the CDC today confirming the first person to contract Ebola here on American soil. The patient who tested positive for the virus is a Dallas nurse involved in the care of Thomas Duncan from Liberia, who died within 2 weeks of coming here. Now, didn't they tell us not to be concerned? That our healthcare system was ready and capable? That hospitals knew the protocol? Healthcare workers knew what to do? They even told us that the chances of it happening here were infinitesimal.
First and foremost, I want the American people to know that our experts here at the CDC and across our government agree that the chances of an Ebola outbreak here in the United States are extremely low.
It seems, however, the only thing that's infinitesimal about Ebola is the amount it takes to catch it. Yet the Dallas hospital, a major metropolitan health center, sends a man home who tells them he's from West Africa, all the while presenting with symptoms consistent with Ebola. The hospital then sends him home, while contagious, to live in his family's apartment, which family then refuses to follow the health department's quarantine by sending their children off to school. And today, a healthcare worker, not even one of those prioritized by the CDC as at risk, who had all the benefits of the protective gear, has contracted the virus. Reminiscent of the doctor and the nurse who also contracted the virus in West Africa. They, too, using all the precautions and suiting up. Now, noticeably absent at today's press conference announcing this new case of Ebola was the CDC, yet they opined that there was a breach in protocol and that changes in the handling of such cases will be forthcoming. Wait a minute. Now you're going to make changes in a protocol that obviously wasn't working, that you said was working, that we were not supposed to worry about? And now I have to worry whether hospitals get the changes, understand the changes, and actually implement the changes. I'm not even convinced that hospitals have the protective gear for all those who could come in contact with the Ebola waste, whether it's the doctors, the nurses, or the maintenance people. They can tell you not to worry. They can tell you it's not going to happen. But the don't worry, be happy line doesn't work anymore. Start worrying. We have a problem, a potential crisis that so far has been screwed up twice. We have an issue. Can you really rely on our healthcare system? Can you rely on the CDC to tell you the whole truth? And if you haven't been worried, I think it's time. Tonight, we're going to hear from doctors who have differing opinions as to how easy it would be to contract the virus. Is your family at risk? Is one hospital better prepared than another? Can pets contract it? Can you contract it from your pets? And if you take one thing from this show tonight, it's that you need to take charge of your family's health care and not assume for 1 minute that somebody, anybody, has you covered. And that's my open. Joining me now, KDFW reporter James Rose. James, what is the latest on the new Ebola patient?
Well, I can tell you they are referring to that patient as patient number 1. As you know, Thomas Eric Duncan was patient 0, the man that originated the Ebola virus here in America. We do not know her name. We do know that she was a nurse that was in very close contact with Duncan while he was in isolation here. We do not know anything more about her condition except that Friday evening she had a slight fever and was exhibiting mild symptoms, Ebola-like symptoms, so she came immediately to the hospital, and we're told within 90 minutes of her feeling that way and taking her temperature, she was here in isolation. Now, you mentioned earlier that these folks are not at risk. Everyone in the medical field is well aware of the risks associated with this disease. These people were allowed to self-monitor themselves because they're healthcare professionals, and they kind of look out for each other. And they were not part of the larger CDC group, the group of 48 people that were being monitored by the CDC. But the fact that this person contracted it definitely did send a shiver through healthcare professionals. But I can tell you she is here. We do not know her condition, except all they will say is she is stable. But at last word, we heard that she had mild Ebola-like symptoms and
well, the CDC today confirmed
fever.
So. The CDC today, this afternoon, confirmed that she did have it. But James, what I want to ask you is that headlines last week were the people in Dallas were, quote, sad and angry. How are people, not the medical people, but the population in general, are they worried?
People are concerned, and they're watching out. But as they've said all along, if you were not in direct contact with Duncan, you really were probably okay. And they've drilled that home. They even made the point where you might have seen Judge Jenkins, the man who's kind of heading up the Dallas County side of this operation. He actually drove with Louise, Duncan's fiancée, to a safe house where they're being monitored. He rode in the car some 45 minutes with him. He went into the apartment that was still being decontaminated. He did that to send a message that, the only way you can contract this is if you get some kind of body fluid on you. So they're pretty much sticking to that. And again, as you heard the CDC say today, they want to find out exactly what that breach in protocol was, because they're taking a closer look at everything from the time before you go into the isolation chamber, who's in the isolation chamber with you, and when you come out and strip off that gear, how is that, what are you doing with that gear? So they're going to be reviewing everything.
James Rose, thank you so much.